channel. And the previous video, the part 1 of this video, I have already discussed that what about the what is the definition for leiomyoma and what it is also known as. So as I have already said, that this uterine leiomyomas, also called as myomas or the uterine fibroids, they are proliferative, well circumscribed, pseudo-capsulated, benign tumors. So they don't have any malignant potential, and they are composed of smooth muscle tissue plus fibrous connective tissue. So this is one line definition of it, and they are most commonly found in the human female pelvis, present in 20 to 25% of the women of the reproductive age group. So this was all about the definition and the occurrence of leiomyoma. Now, in succession to the previous video of mine, as I've already discussed about the risk factor, now slowly and gradually we'll see about the epidemiological evidence of hereditability. So very important, viewers, that women of African origin, it has been found, they experience a 3 to 9-fold higher prevalence of leiomyomas than women of other racial and ethnic groups. So do remember that it is the women of African origin, they have a greater, they experience 3 to 9-fold higher prevalence of leiomyomas than the women of other racial and ethnic groups. Apart from this, when we look at the incidence, so incidence, what do we find is that the monozygotic twins, they have twice greater incidence as compared to the dizygotic twins. So viewers, do remember that the monozygotic twins, they have a twice more incidence as compared to the dizygotic twins. Now moving on to the next important, very important fact, that the incidence of that is the leiomyomas, are more common in relatives of women whose in are more common in relatives of women with leiomyomas. So actually it has been seen that this leiomyoma is very common if it is occurring in a particular family. So there are some relatives of the women who are suffering from this leiomyoma. So such women, they are more, there can be a possibility that that is a heritable disease. So this is the evidence what it is showing, that the women whose relatives are having leiomyoma, they might have a chance, they might experience leiomyoma sometime in their life. So this is the evidence what do we find in regards to the hereditability of the leiomyomas or the uterine fibroids. So if a particular woman in a particular family, she is having these uterine fibroids, so there is a possibility, there might be a chance that the other women belonging to the same pedigree, same family, they are more susceptible for getting for having leiomyomas in the uterine cavity. Now when we look at the pathology of the leiomyomas, so starting with, when we look at the pathology of the leiomyomas or the uterine fibroids, this is very important, that leiomyomas are slow growing. They are very slow growing, benign, smooth muscle tumors containing smooth muscle cells, fibrous tissue, and collagen matrix. So do remember, the word itself is suggesting, leo, as I have already said, it means smooth. Myo means muscle. And wherever the suffix oma is added, it refers to some kind of a tumorous proliferation. So this leiomyoma, the word itself is suggesting that it is oma suffix is added, that is referring to a tumor, that it is a benign tumor of the smooth muscle, and particularly which involves the uterine wall. So this is the uterine leiomyoma what we are discussing. When we look at the pathology of this uterine leiomyoma, so it is consisting of the smooth muscle cells, the fibrous tissue, and the collagen matrix. Now they are called leiomyomas. Why? Since they contain large amount of collagen. So do remember, students and viewers, so these leiomyomas, they are common, they are called as leiomyomas. Why? Just because they contain a large amount of collagen and fibrous tissue. So here it is the schematic diagram I have already drawn. So you can see, visualize the schematic diagram of the uterus. So this is the uterus what I have drawn, and these are the sites where the leiomyomas can frequently occur. They can occur at the site of the uterine cervix. So this is the cervix what I have drawn. Apart from this, they can also be having pedunculated, they can have a stalk attached to it, so they can be called as the pedunculated leiomyoma. They can be inside the uterine muscle mass, that is the intramural, and the intramural types, they are embedded inside the uterine muscle mass, the pedunculated, and there are certain ones which can be below this with having attachment to the subserous. Apart from this, there is a rare possibility that they can be attached to the ligaments, so there can be intraligamentary types. Apart from this, there can be submucosal type. So the submucosal type of this leiomyoma, it is ultimately, it can proliferate into the uterine cavity. So it progresses the bulge, the swelling of the benign tumor. It is going to intrude into the uterine cavity as well. So this is submucosal type. It is having a projection into the uterine cavity as well. So these are the types of which are the sites in the uterine cavity where the leiomyomas can be seen. Apart, as I've already said, so since they contain a large amount of collagen and fibrous tissue, so that's why they are called as leiomyomas. And do remember, majority of the leiomyomas, where is the site of it? So do remember, viewers and students, that majority of the leiomyomas, they arise from the body of the uterus. So this is the picture of the body of the uterus I've already drawn over here. So you can see, so this is the body of the uterus. So actually, the leiomyomas are very frequently found in the body of the uterus. So arise from the body of the uterus, and the vasculature, the blood supply, is located on the periphery. So do remember, viewers and students, if it is a leiomyoma, it is a uterine fibroids, the vasculature, the blood supply of this uterine leiomyoma, the fibroids, it is occurring on the superficial. It is located on the periphery of the leiomyoma and the central part of the tumor. So the central part of the tumor is susceptible to degenerative changes and necrosis. So do remember, it is only the peripheral part which is having the vascular supply or the blood supply, and the central part of the uterine fibroid, it is susceptible to degenerative changes as well as necrosis. So this fact needs to be very importantly memorized. Apart from this, in this video, I have already talked about the pathology we have discussed. Now moving on to the types. Now, in the picture what I have drawn over here, so this is the schematic diagram of the uterine cavity. So this is the body of the uterus, this is the cervix, these are the fallopian tubes extension. So actually, the types of the leiomyoma, the uterine fibroids, they can be of the following three types, most importantly. So beginning with, first is the intramural or the interstitial leiomyomas. So the intramural or the interstitial leiomyomas, where they are present, they remain inside the uterine wall. So do remember, viewers and students, so it is the intramural type. See, you can see over here, I have already drawn. This is one of the benign tumors which is located inside the uterine wall, and this one is also located inside the uterine wall. So if the leiomyomas, these swellings, these tumors, if they are located within the uterine wall, inside the uterine wall, they are referred to as the intramural or the interstitial type of the leiomyomas, and their occurrence is most common. That is most common in 75% of the cases. We find that this leiomyomas, this is of the intramural or the interstitial type. Next, moving on, the submucous type. So submucous, actually, they are incidence of only 15%, and so this submucosal type is that type which is growing towards the uterine cavity. So in this picture, I have already drawn that it is the uterine cavity over here. So this is dotted one I am drawing. This is the uterine cavity, and the submucous type of leiomyomas is growing towards the uterine cavity. Next, moving on to the subserous type. So only 10% of those are found in the subserous zone. So those are lying just beneath the serosa. So they are accounting for 10% of the leiomyomas, and rarely the leiomyomas arise from the cervix. So as I've already drawn near the cervix, that near the after this there will be the vagina. So near the cervix, rarely leiomyomas arise from the cervix, or they can also arise, they can also be attached to certain ligaments. So this is the intraligamentary and the cervical types. So in all, how many types are there? In all, we can count. One is the submucosal type, which can proceed into the uterine cavity. The most common type is the intramural or the interstitial types, which can be seen in the embedded in the uterine wall, and the subserous type accounts for 10% just beneath the serosa, and the pedunculated forms, they can be having a stalk-like projection through which they can have a stalk, and they can have this pedunculated structure which is getting inside the uterine cavity. And last but not the least, they can be of the either of the intraligamentary or the cervical types. So students and viewers, this was a very short discussion where I have discussed about the uterine leiomyomas, which is also known as the uterine fibroids. So students and viewers, in the upcoming videos, I'll be covering up the entire, slowly and gradually, I'll move on to the entire topics what are there in gynecology. And if you still the entire topics what are there in gynecology, and if you still have any queries or comments, you are most welcome to comment me in the comment section. And if you have any queries, any topics what you want in gynecology from me, you are most welcome to comment me in the comment section. I'll certainly take up those topics on your request from gynecology. So thank you for watching.